Question 1. Which approach would be most appropriate for the Alcoitao Higher School of Health to take when a prospective student expresses deeply held personal beliefs that appear to conflict with certain aspects of the health sciences curriculum during the entrance examination process? Option A. Proceed with the standard admission process without addressing the student's expressed concerns, assuming they will adapt once enrolled. Option B. Advise the student to reconsider their career choice if their beliefs are fundamentally incompatible with the principles of healthcare. Option C. Immediately disqualify the student from admission based on the perceived conflict, citing the need for absolute adherence to all curriculum components. Option D. Engage in a supportive dialogue with the student to understand the nature of their beliefs and explore potential accommodations that align with professional ethical standards and program learning outcomes. The correct answer is D. Engage in a supportive dialogue with the student to understand the nature of their beliefs and explore potential accommodations that align with professional ethical standards and program learning outcomes. Explanation. This scenario presents a professional challenge due to the conflict between a student's personal beliefs and the academic requirements of a health sciences program. The Alcoitao Higher School of Health entrance exam regulations, while not explicitly detailed here, are presumed to uphold principles of academic integrity, non-discrimination, and the professional standards expected of future healthcare practitioners. The core of the challenge lies in balancing the student's right to personal beliefs with the institution's responsibility to ensure all students are prepared to meet the diverse needs of patients without prejudice. Careful judgment is required to uphold both individual rights and professional obligations. The correct approach involves seeking a constructive dialogue with the student to understand the nature of their beliefs and explore potential accommodations that do not compromise the essential learning outcomes or ethical standards of the program. This approach prioritizes open communication, empathy, and a commitment to finding a solution that respects the student's individuality while ensuring their readiness for professional practice. Regulatory and ethical justification for this approach stems from the general principles of fairness, inclusivity, and the duty of care inherent in educational institutions, particularly those preparing individuals for health professions. It aligns with the expectation that healthcare professionals will serve all individuals with respect and dignity, regardless of personal beliefs. An incorrect approach that involves immediate dismissal or rigid adherence to a policy without exploring alternatives fails to consider the nuances of the situation and may violate principles of natural justice or institutional policies on student support. This approach risks alienating the student and failing to identify if the student's beliefs are truly incompatible with the core competencies of the profession, or if they are based on misunderstandings that can be addressed through education. Another incorrect approach, which is to ignore the student's concerns and proceed with the standard curriculum without any attempt at understanding or accommodation, is ethically problematic. It demonstrates a lack of empathy and a failure to recognize the potential impact of deeply held beliefs on a student's ability to engage with and succeed in their studies, particularly in a field that requires compassionate care. This approach neglects the institution's responsibility to support its students and ensure their preparedness for the complexities of healthcare. A further incorrect approach, such as attempting to force the student to abandon their beliefs, is a violation of personal autonomy and is ethically indefensible. Educational institutions are not in the business of dictating personal convictions, but rather of equipping students with the knowledge and skills to practice professionally and ethically. The professional decision-making process for similar situations should involve a structured approach. First, actively listen to and understand the student's concerns and the basis of their beliefs. Second, consult relevant institutional policies and ethical guidelines pertaining to student conduct, academic integrity, and professional standards. Third, assess the potential impact of the student's beliefs on their ability to meet program requirements and future professional responsibilities. Fourth, explore all possible reasonable accommodations that do not compromise essential learning outcomes or ethical obligations. Finally, document all discussions and decisions thoroughly. Question 2. Implementation of a supportive response to a distressed student presenting with symptoms suggestive of an acute health issue, where immediate direct supervision is not readily available, requires careful consideration of ethical obligations and institutional protocols. Option A. Administer over-the-counter pain relief medication to alleviate the student's discomfort while you wait for a supervisor to become available. Option B. Immediately contact the student's emergency contact person listed in their student file to inform them of the situation. Option C. Advise the student to go home and rest, and suggest they contact their own doctor if their symptoms worsen. Option D. Provide immediate comfort and reassurance to the student. Assess their immediate symptoms within your scope of practice, and then promptly report the situation and seek guidance from the designated Alcoitao Higher School of Health faculty supervisor or health services coordinator. The correct answer is D. Provide immediate comfort and reassurance to the student. Assess their immediate symptoms within your scope of practice, and then promptly report the situation and seek guidance from the designated Alcoitao Higher School of Health faculty supervisor or health services coordinator. Explanation: this scenario is professionally challenging because it requires balancing the immediate needs of a patient with the ethical obligations of healthcare professionals and the established protocols of Alcoitao Higher School of Health. The student's distress and potential for harm necessitate a prompt response, but any action must adhere to the school's guidelines regarding student welfare, privacy, and the scope of practice for student health professionals. Careful judgment is required to ensure that interventions are both compassionate and compliant with regulatory frameworks. The correct approach involves acknowledging the student's distress, offering immediate support within the scope of a student health professional's role, and then escalating the situation to the appropriate designated personnel within Alcoitao Higher School of Health. This aligns with the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, while also respecting the organizational structure and reporting lines mandated by the school's internal regulations and any overarching health professional codes of conduct applicable to students. Specifically, it recognizes that, while immediate comfort is important, a comprehensive assessment and appropriate intervention may require the involvement of more experienced staff or specialized services, thereby ensuring the student receives the most effective and safe care. An incorrect approach that involves directly administering medication without proper assessment or authorization fails to uphold the principle of non-maleficence. This could lead to adverse drug reactions, incorrect dosage, or contraindications, all of which would be a direct violation of patient safety protocols and potentially the regulatory framework governing the practice of health professionals, even at the student level. Furthermore, it bypasses established diagnostic and treatment pathways, undermining the professional integrity of the student and the institution. Another incorrect approach, which is to ignore the student's distress due to a lack of direct supervisory presence, violates the ethical duty of care. Healthcare professionals, including students under supervision, have a responsibility to respond to patients in need. Failing to do so, even if it stems from a perceived lack of authority or clear protocol, can lead to significant harm and is a breach of professional conduct. It demonstrates a lack of empathy and a failure to prioritize patient well-being. A third incorrect approach, which is to immediately contact the student's family without assessing the situation or considering the student's consent and privacy, can also be problematic. While family involvement might be necessary in some circumstances, it should be a considered step, not an automatic one. It risks breaching patient confidentiality and may not be the most appropriate first step, especially if the student is capable of discussing their concerns, or if the issue is something that can be managed internally by the school's health services. The professional decision-making process for similar situations should involve a rapid assessment of the immediate risk to the student, followed by an evaluation of available resources and established protocols. This includes understanding one's own scope of practice and limitations as a student health professional. The process should prioritize patient safety and well-being, adhere to ethical principles, and ensure compliance with institutional policies and relevant professional guidelines. Escalation to appropriate supervisors or designated support services is a critical component of responsible practice when faced with situations that exceed a student's immediate capacity or authority. Question 3. Governance review demonstrates that a student at Alcoitao Higher School of Health, experiencing significant distress and claiming to have lost their prescribed anxiety medication, approaches you, a staff member, requesting an immediate supply of a specific over-the-counter sedative that is not typically stocked by the school's health services. The student insists they need it urgently to manage their anxiety before an upcoming examination. What is the most appropriate course of action? Option A. Advise the student to wait until they can see a doctor outside of Alcoitao Higher School of Health and dismiss their immediate concerns, citing institutional policy. Option B. Escalate the situation to the designated student support services or a supervisor, explaining the student's distress and request, and await their guidance on how to proceed within Alcoitao's established protocols. Option C. Provide the student with the requested over-the-counter sedative from any available stock, assuming it is a common medication, and the student's distress warrants immediate intervention. Option D. Offer the student general relaxation techniques and suggest they try to manage their anxiety without any medication, as Alcoitao Higher School of Health does not dispense such items. The correct answer is B. Escalate the situation to the designated student support services or a supervisor, explaining the student's distress and request, and await their guidance on how to proceed within Alcoitao's established protocols. Explanation. This scenario is professionally challenging because it pits the immediate needs of a vulnerable patient against established institutional protocols and the potential for future harm if those protocols are circumvented. The healthcare professional must balance their duty of care to the individual with their responsibility to uphold the integrity and safety standards of Alcoitao Higher School of Health. Careful judgment is required to avoid compromising patient well-being, while also respecting the governance framework. The correct approach involves prioritizing the patient's immediate safety and well-being by seeking appropriate, authorized assistance without violating established procedures. This means escalating the situation through the designated channels within Alcoitao Higher School of Health, such as informing a supervisor or the designated safeguarding officer. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, as well as the implicit regulatory expectation that healthcare professionals will act responsibly and within their scope of practice and institutional guidelines. Alcoitao's internal policies and the broader ethical codes governing healthcare professionals in this jurisdiction would mandate reporting and seeking assistance through official channels to ensure proper oversight and intervention. An incorrect approach would be to directly provide the patient with unauthorized substances or information that bypasses the established medical and administrative processes. This is ethically unsound as it could lead to incorrect dosages, adverse drug interactions, or the patient receiving inappropriate treatment, thereby causing harm. It also represents a regulatory failure by disregarding the established governance and safety protocols of Alcoitao Higher School of Health, potentially exposing the institution and the individual to liability. Another incorrect approach would be to ignore the patient's request entirely, citing institutional policy without attempting to find a compliant solution. While adhering to policy is important, a complete lack of engagement can be seen as a failure of the duty of care, potentially leading to patient distress and a worsening of their condition if their request stems from a genuine, albeit improperly articulated, need. This approach fails to demonstrate compassion and proactive problem-solving within the ethical framework. The professional decision-making process for similar situations should involve a clear assessment of the immediate risk to the patient, identification of the relevant institutional policies and ethical guidelines, and a systematic approach to seeking appropriate assistance. This typically involves 1. Recognizing the ethical and safety implications of the situation. 2. Consulting relevant policies and professional codes of conduct. 3. Escalating the issue to the appropriate authority within the institution. 4. Documenting all actions taken and communications. 5. Ensuring patient confidentiality is maintained throughout the process. Question 4. During the evaluation of an applicant for the Alcoitao Higher School of Health entrance exam, it is revealed that the applicant holds strong personal beliefs that, if applied in a professional healthcare setting, could lead to a refusal to provide certain standard treatments to specific patient groups based on their identity. The admissions committee must decide how to proceed. Which of the following approaches best aligns with the ethical and regulatory framework expected of future healthcare professionals in Alcoitao? Option A. Recommend that the applicant be excused from specific modules of the curriculum that might challenge their personal beliefs, ensuring their comfort during their studies. Option B. Focus on the applicant's academic qualifications and personal beliefs, without emphasizing the potential conflict with future professional responsibilities, assuming they will adapt upon entering practice. Option C. Suggests that the applicant's personal beliefs might be accommodated in certain specialized areas of healthcare, where direct patient interaction with the affected groups is minimal. Option D. Acknowledge the applicant's right to personal beliefs, but firmly explain that these beliefs cannot supersede the professional and ethical obligations to provide equitable care to all patients, as mandated by Alcoitao's healthcare regulations and professional codes of conduct. The correct answer is D. Acknowledge the applicant's right to personal beliefs, but firmly explain that these beliefs cannot supersede the professional and ethical obligations to provide equitable care to all patients, as mandated by Alcoitao's healthcare regulations and professional codes of conduct. Explanation. This scenario presents a professional challenge due to the inherent conflict between a student's personal beliefs and the established ethical and regulatory standards of healthcare practice. The Alcoitao Higher School of Health entrance exam, like any reputable institution, mandates adherence to professional conduct that prioritizes patient well-being and equitable treatment, irrespective of personal biases. The core of the challenge lies in balancing the student's right to personal belief with the professional obligation to uphold non-discriminatory healthcare delivery. Careful judgment is required to ensure that the student's future professional actions align with the ethical principles and regulatory framework governing healthcare professionals in Alcoitao. The correct approach involves acknowledging the student's personal beliefs while firmly reinforcing the non-negotiable ethical and regulatory requirements of the healthcare profession. This approach prioritizes the integrity of the profession and the protection of future patients. Specifically, it requires the student to understand that while personal beliefs are not inherently wrong, they cannot dictate professional conduct when it conflicts with established ethical codes and legal mandates that ensure all individuals receive care without prejudice. The regulatory framework of Alcoitao, which emphasizes principles of beneficence, non-maleficence, justice, and respect for autonomy, implicitly requires healthcare professionals to set aside personal biases that could impede the delivery of equitable and effective care. This approach ensures that the student is prepared to practice within the bounds of professional responsibility and ethical conduct, as expected by the Alcoitao Higher School of Health and the broader healthcare system. An incorrect approach that attempts to accommodate the student's personal beliefs by suggesting they might be permissible in certain contexts fails to uphold the fundamental ethical principles of non-discrimination and equitable care. This approach risks normalizing discriminatory practices and undermines the trust placed in healthcare professionals. It is a failure to adhere to the core tenets of professional responsibility, which demand impartiality in patient care. Another incorrect approach that suggests the student should be excused from certain aspects of their training due to their personal beliefs is equally problematic. This not only compromises the student's comprehensive education, but also sets a dangerous precedent. It implies that personal beliefs can override the necessity of acquiring all essential skills and knowledge required for safe and ethical practice, thereby failing to protect the public and uphold professional standards. A third incorrect approach that focuses solely on the student's right to hold personal beliefs without adequately addressing the professional obligations creates a significant ethical gap. While individuals have the right to their beliefs, the professional sphere demands a commitment to a higher standard of conduct that ensures the well-being of all individuals served. This approach neglects the crucial aspect of professional accountability and the potential harm that can arise from the unchecked influence of personal biases in a professional setting. The professional decision-making process for similar situations should involve a clear understanding of the relevant ethical codes and regulatory guidelines. It requires an objective assessment of the situation, identifying any potential conflicts between personal beliefs and professional obligations. The next step is to communicate these professional expectations clearly and unequivocally to the individual, emphasizing the non-negotiable nature of ethical conduct and legal requirements. Finally, it involves ensuring that the individual understands the consequences of failing to adhere to these standards, and providing support for them to align their actions with professional expectations, if possible, or making appropriate decisions regarding their suitability for the profession, if alignment is not achievable. Question 5. Governance review demonstrates a significant increase in reported student stress levels at Alcoitao Higher School of Health, prompting a need for enhanced mental health support. The review also highlights a desire to align these efforts with the school's strategic objectives of fostering a supportive learning environment and promoting holistic student development. considering the school's existing regulatory framework and ethical guidelines. Which of the following approaches best addresses this situation? Option A. Immediately procure and implement a popular, off-the-shelf mental health application that has received positive media attention, assuming it will broadly meet student needs. Option B. Conduct a thorough needs assessment involving student surveys, focus groups, and consultations with faculty and student support staff to identify specific stressors and preferred support mechanisms. Then develop a tailored intervention plan based on these findings. Option C. Prioritize budget reallocation towards administrative efficiencies, with any remaining funds to be allocated to a single, low-cost mental health awareness campaign. Option D. Rely on informal feedback from a few vocal faculty members to guide the selection of a new mental health initiative, focusing on interventions that require minimal faculty time. The correct answer is B. Conduct a thorough needs assessment involving student surveys, focus groups, and consultations with faculty and student support staff to identify specific stressors and preferred support mechanisms. Then develop a tailored intervention plan based on these findings. Explanation. This scenario is professionally challenging because it requires balancing the immediate needs of student well-being with the long-term strategic goals of the Alcoitao Higher School of Health, all while adhering to its specific regulatory framework. The pressure to demonstrate tangible improvements in student mental health services, coupled with potential budget constraints and the need for faculty buy-in, creates a complex decision-making environment. Careful judgment is required to ensure that any proposed changes are both effective and sustainable, and that they align with the school's mission and ethical obligations to its students. The correct approach involves a comprehensive needs assessment and stakeholder consultation. This method is right because it ensures that any proposed interventions are evidence-based, tailored to the specific needs of the Alcoitao student population, and have the support of those who will implement and be affected by them. This aligns with the Alcoitao Higher School of Health's commitment to student welfare and its responsibility to operate within its established governance and ethical guidelines, which likely prioritize student outcomes and responsible resource allocation. An approach that focuses solely on implementing a widely publicized but potentially generic mental health app without understanding its suitability for the Alcoitao context is ethically flawed. It risks misallocating resources and failing to address the root causes of student distress, potentially violating the school's duty of care. Similarly, an approach that prioritizes cost-cutting measures over actual service enhancement, even if it appears fiscally responsible on the surface, fails to meet the ethical imperative of providing adequate support to students, which is a core function of a health-focused educational institution. Finally, an approach that relies on anecdotal evidence or the loudest voices within the faculty, without a systematic evaluation, can lead to biased decision-making and may not reflect the true needs of the broader student body, thereby failing to uphold principles of fairness and evidence-based practice. Professionals in such situations should employ a structured decision-making process that begins with clearly defining the problem and its scope. This should be followed by gathering relevant data through needs assessments and consulting with all affected stakeholders, evaluating potential solutions against established criteria, including effectiveness, feasibility, ethical implications, and alignment with institutional goals, is crucial. Finally, implementing the chosen solution with a plan for ongoing monitoring and evaluation ensures accountability and continuous improvement. Question 6. Performance analysis shows a potential trend in student health outcomes that could indicate a public health concern within the Alcoitao Higher School of Health community. The data is preliminary and requires further verification, but some stakeholders are requesting immediate access to the findings to inform their planning. Which of the following actions best balances the need for timely information with the ethical and regulatory obligations of the institution? Option A. Share the raw performance data only with senior administrative staff, instructing them to keep the information confidential and to use it solely for internal discussions. Option B. Verify the data thoroughly, anonymize it to protect individual privacy, and then communicate the anonymized findings and the ongoing verification process to all relevant stakeholders. Option C. Immediately share the raw, unverified performance data with all stakeholders to ensure they have the most up-to-date information for their planning. Option D. Delay all communication to stakeholders until the data is absolutely perfect and all potential implications have been fully explored, which could take an extended period. The correct answer is B. Verify the data thoroughly, anonymize it to protect individual privacy, and then communicate the anonymized findings and the ongoing verification process to all relevant stakeholders. Explanation. This scenario presents a professional challenge due to the inherent conflict between the immediate need to address a potential public health concern and the procedural requirements for data handling and privacy, as mandated by Alcoitao Higher School of Health's internal policies and relevant health data protection guidelines. The pressure to act swiftly must be balanced against the obligation to ensure data integrity and confidentiality. The correct approach involves a structured process of data verification and anonymization before any broad dissemination of findings. This aligns with ethical principles of responsible research and data stewardship, and importantly, with the Alcoitao Higher School of Health's commitment to protecting the privacy of individuals whose data might be involved in performance analysis. By first verifying the accuracy of the data and then anonymizing it, the institution upholds its duty of care and adheres to any applicable data protection regulations that would prevent the unauthorized disclosure of sensitive information. This methodical approach ensures that any subsequent communication is based on reliable, de-identified data, thereby safeguarding both the reputation of the institution and the trust of its stakeholders. An incorrect approach would be to immediately share the raw performance data with all stakeholders. This fails to acknowledge the potential for errors in the initial analysis, and more critically, breaches the privacy of individuals whose data is contained within the performance metrics. Such a failure would violate Alcoitao Higher School of Health's internal data privacy policies and potentially contravene broader ethical guidelines for health data handling, leading to a loss of trust and potential legal repercussions. Another incorrect approach is to delay any communication indefinitely while awaiting a perfect, fully verified dataset. While thoroughness is important, an indefinite delay in addressing a potential public health issue, even if the data is not yet fully polished, can be professionally irresponsible. This approach neglects the stakeholders' right to be informed in a timely manner, especially when the information, even in a preliminary form, could be crucial for decision-making or further investigation. It prioritizes absolute perfection over timely, albeit cautious, communication. A further incorrect approach would be to selectively share the raw data with only a select group of stakeholders without a clear, justifiable rationale or established protocol. This creates an uneven playing field of information, fosters suspicion, and undermines transparency. It also carries the same privacy risks as sharing with all stakeholders without anonymization. The professional decision-making process in such situations requires a commitment to transparency, accuracy, and privacy. It involves 1. Recognizing the dual imperatives of timely communication and data protection. 2. Implementing a robust data verification and anonymization protocol. 3. Communicating findings in a phased manner, starting with verified and anonymized data and clearly stating any limitations. 4. Ensuring that all communication adheres to the Alcoitao Higher School of Health's established policies and relevant ethical standards for data handling and public health information dissemination. Question 7. System analysis indicates that a student at Alcoitao Higher School of Health, during their mandatory clinical placement in a palliative care unit, develops profound personal objections to a specific treatment modality that is standard practice and ethically approved within the Alcoitao regulatory framework for patient comfort. The student feels ethically conflicted about their ability to provide care that involves this modality, even if it is for symptom management. Which of the following represents the most professionally appropriate course of action for the student? Option A. Seek to be excused from the clinical placement entirely, citing personal ethical grounds, without engaging in any dialogue with the school about the specific nature of their concerns or potential solutions. Option B. Publicly express their opposition to the treatment modality to patients and other staff members, advocating for its immediate cessation within the unit. Option C. Continue with the clinical placement, attempting to mentally compartmentalize their beliefs and hope that the conflict resolves itself without external intervention. Option D. Immediately inform the clinical supervisor and the relevant academic department of their ethical concerns, requesting a discussion about potential accommodations or alternative placements that align with their conscience while still fulfilling program requirements. The correct answer is D. Immediately inform the clinical supervisor and the relevant academic department of their ethical concerns, requesting a discussion about potential accommodations or alternative placements that align with their conscience while still fulfilling program requirements. Explanation. This scenario presents a professional challenge due to the inherent conflict between a student's personal beliefs and the ethical obligations of a healthcare professional, particularly within the context of a regulated educational institution like Alcoitao Higher School of Health. The core of the challenge lies in balancing the student's right to personal conviction with the imperative to uphold professional standards and patient welfare, as dictated by the Alcoitao regulatory framework. Careful judgment is required to ensure that personal beliefs do not impede the delivery of competent and ethical care, nor compromise the integrity of the educational program. The correct approach involves a proactive and transparent engagement with the institution's faculty and relevant ethical guidelines. This approach prioritizes open communication and seeks to find a resolution that respects both the student's conscience and the school's commitment to professional healthcare education. Specifically, it requires the student to articulate their concerns to the appropriate academic or ethical review board within Alcoitao Higher School of Health, referencing any relevant internal policies or codes of conduct that address conscientious objection or ethical dilemmas. This demonstrates a commitment to resolving the conflict constructively and in accordance with the established regulatory framework, ensuring that patient care and educational objectives are not jeopardized. An incorrect approach that involves unilaterally refusing to participate in a required clinical placement without prior consultation or seeking accommodation would be professionally unacceptable. This failure stems from a disregard for the established procedures and communication channels within Alcoitao Higher School of Health, potentially violating academic regulations and professional conduct guidelines. Such an action could be interpreted as insubordination and a lack of commitment to the educational program, leading to disciplinary action. Another incorrect approach, that of attempting to persuade fellow students or faculty to alter the curriculum based solely on personal beliefs without following institutional protocols, is also professionally unsound. This bypasses the formal channels for curriculum review and ethical debate, potentially creating disruption and undermining the authority of the institution's governing bodies. It fails to acknowledge the structured process for addressing ethical concerns within Alcoitao Higher School of Health. Finally, an incorrect approach that involves concealing the personal belief conflict and proceeding with clinical duties while experiencing significant distress would be ethically problematic. This approach risks compromising the quality of care provided due to internal conflict and a lack of support. It also fails to uphold the principle of honesty and transparency expected of future healthcare professionals within the Alcoitao framework. The professional decision-making process for similar situations should involve a systematic approach. First, understanding the specific ethical principles and regulatory requirements of Alcoitao Higher School of Health. Second, identifying the nature of the conflict. Third, exploring all available avenues for resolution within the institution's framework, including seeking guidance from faculty, mentors, or ethics committees. And fourth, acting with transparency and integrity throughout the process. Question 8. System analysis indicates that the Alcoitao Higher School of Health is preparing to launch its entrance examination process. To streamline candidate assessment and ensure a fair evaluation, the admissions committee has proposed collecting a comprehensive set of personal and academic data from all applicants. Considering the regulatory framework governing educational institutions and student data within Alcoitao's jurisdiction, which of the following approaches best balances the need for essential applicant information with the imperative of data privacy and ethical data handling? Option A. Delegate the decision-making on data collection to the IT department, instructing them to implement the most secure data storage solutions available, without a prior detailed assessment of the specific data types needed or their legal justification. Option B. Collect all proposed personal and academic data, assuming that comprehensive information is always beneficial for a thorough assessment, and inform applicants of the data collection in the General Admissions Policy document. Option C. Conduct a detailed review of the entrance examination's specific assessment criteria to identify only the absolutely necessary data points required for eligibility and scoring. Establish a clear legal basis for collecting and processing this minimal data, and obtain explicit, informed consent from applicants for its use. Option D. Proceed with collecting a broad range of data that might be useful for future institutional research or alumni engagement, justifying the collection by the potential long-term benefits to the institution, and provide a general privacy notice that mentions data may be used for various purposes. The correct answer is B. Collect all proposed personal and academic data, assuming that comprehensive information is always beneficial for a thorough assessment, and inform applicants of the data collection in the General Admissions Policy document. Explanation. This scenario presents a professional challenge due to the inherent conflict between the immediate need for student data to assess eligibility and the ethical and regulatory obligations to protect sensitive personal information. The Alcoitao Higher School of Health Entrance Exam Framework, like many educational and health-related institutions, operates under strict data privacy regulations. The primary challenge lies in balancing the operational requirements of the admissions process with the fundamental right to privacy and the legal mandates governing data handling. Careful judgment is required to ensure that data collection and processing are lawful, fair, and transparent, minimizing potential harm to applicants. The correct approach involves a multi-stakeholder consultation process that prioritizes understanding the specific data requirements for the entrance exam, identifying the legal basis for collecting and processing such data under Alcoitao's regulatory framework, and then developing a data protection strategy that aligns with these requirements. This strategy must include clear consent mechanisms, data minimization principles, secure storage, and defined access controls. This approach is correct because it proactively addresses potential privacy risks and ensures compliance with the Alcoitao Higher School of Health's internal policies and any overarching national data protection laws relevant to educational institutions. It demonstrates a commitment to ethical data stewardship and builds trust with prospective students by showing respect for their personal information. An incorrect approach would be to proceed with data collection without a thorough understanding of the legal basis, or without implementing robust data protection measures. This could lead to violations of privacy laws, resulting in reputational damage, legal penalties, and a loss of trust from applicants. Another incorrect approach would be to collect more data than is strictly necessary for the entrance exam assessment, even if it seems potentially useful for future profiling. This violates the principle of data minimization, which is a cornerstone of responsible data handling. Finally, an approach that fails to inform applicants clearly about how their data will be used, stored, and protected is ethically unsound and likely to contravene transparency requirements mandated by regulations. The professional decision-making process for similar situations should involve a systematic risk assessment. First, identify the purpose for data collection and the specific data points required. Second, determine the legal basis for processing this data, consulting relevant Alcoitao regulations and any applicable national data protection legislation. Third, design data collection and processing procedures that adhere to principles of necessity, proportionality, and transparency. Fourth, implement technical and organizational measures to ensure data security and confidentiality. Fifth, establish clear communication channels with applicants regarding data handling practices. This structured approach ensures that operational needs are met without compromising ethical standards or legal obligations. Question 9. The control framework reveals that a student nurse at Alcoitao Higher School of Health is asked by a patient to administer a pain relief medication that is not on their current care plan. The student nurse has not been specifically trained or authorized to administer this particular medication in this context. What is the most appropriate course of action for the student nurse? Option A. Immediately seek clarification and guidance from their supervising registered nurse or clinical instructor before taking any action. Option B. Politely decline the patient's request and inform them that they cannot assist with that specific medication. Option C. Locate the medication in the ward's supply and administer it, then inform the supervising nurse afterward. Option D. Administer the medication as requested by the patient, assuming it is for their comfort and well-being. The correct answer is A. Immediately seek clarification and guidance from their supervising registered nurse or clinical instructor before taking any action. Explanation. This scenario presents a professional challenge because it requires balancing the immediate needs of a patient with the established protocols and ethical considerations surrounding the administration of medication. The student nurse is in a position of trust and responsibility, and any deviation from approved procedures could have serious consequences for the patient and the institution. Careful judgment is required to ensure patient safety while adhering to the Alcoitao Higher School of Health's guidelines. The correct approach involves the student nurse seeking immediate clarification and guidance from their supervising registered nurse or clinical instructor. This upholds the principle of professional accountability and patient safety by ensuring that medication is administered only under direct supervision and according to established protocols. The Alcoitao Higher School of Health's regulatory framework, as implied by its entrance exam context, would prioritize patient well-being and the integrity of the learning process. This approach aligns with the ethical duty of care and the requirement for supervised practice in healthcare education. An incorrect approach would be for the student nurse to administer the medication without proper authorization or supervision. This directly violates the principle of patient safety, as the student may not have the full clinical judgment or experience to assess the patient's current condition or potential contraindications. It also breaches the Alcoitao Higher School of Health's implicit guidelines for supervised practice, potentially leading to medication errors, adverse events, and disciplinary action. Another incorrect approach would be for the student nurse to ignore the request and proceed with other tasks. This demonstrates a lack of professional responsibility and a failure to respond to a patient's needs, even if the request is outside their immediate scope. It also misses a crucial learning opportunity and could be interpreted as insubordination or a disregard for patient care. A further incorrect approach would be for the student to attempt to find the medication themselves and administer it without consulting their supervisor. This bypasses the established control framework and demonstrates a lack of understanding of the importance of supervision and protocol adherence in a healthcare setting. The professional decision-making process in such situations should involve a clear understanding of one's scope of practice, a commitment to patient safety, and a proactive approach to seeking guidance from supervisors. When faced with a request that falls outside of established protocols or personal competency, the immediate and appropriate action is to consult with a qualified and authorized healthcare professional. Question 10. Benchmark analysis indicates that prospective students may approach admission staff with concerns about the difficulty or format of the Alcoitao Higher School of Health entrance exam. A student, expressing significant anxiety, asks for specific advice on which topics are most heavily weighted and for examples of question types that are particularly challenging. What is the most appropriate professional response? Adhering strictly to the Alcoitao Higher School of Health's regulatory framework for entrance examinations. Option A. Suggest that the student seek private tutoring that specializes in preparing candidates for the Alcoitao Higher School of Health entrance exam, without providing any specific guidance on content. Option B. Provide the student with general information about the exam structure and the types of skills it assesses, directing them to official study guides and advising them to utilize the school's general academic support resources. Option C. Offer the student specific examples of challenging questions and highlight the topics that are known to be most difficult based on previous exam performance data. Option D. Advise the student to focus their study efforts on the topics that have historically been the most challenging for applicants, as this is where they are most likely to encounter difficulties. Correct answer is B. Provide the student with general information about the exam structure and the types of skills it assesses, directing them to official study guides, and advising them to utilize the school's general academic support resources. Explanation. This scenario presents a professional challenge rooted in balancing the immediate needs of a student with the established ethical and regulatory obligations of an educational institution. The Alcoitao Higher School of Health entrance exam framework, while not explicitly detailed here, implies a commitment to fairness, integrity, and student welfare within its operational guidelines. The challenge lies in discerning when to offer support that might be perceived as preferential versus upholding the standardized assessment process designed to ensure equitable evaluation for all applicants. Careful judgment is required to avoid compromising the integrity of the entrance examination, while still demonstrating institutional responsibility towards its prospective students. The correct approach involves a commitment to the established Alcoitao Higher School of Health entrance exam protocols for candidate support. This means providing general, non-discriminatory information about available resources and procedures that apply to all applicants, without offering specific advantages or tailored assistance that could influence the outcome of the entrance examination. This aligns with the ethical imperative of maintaining a level playing field and ensuring that all candidates are assessed based on the same criteria. Regulatory adherence would dictate that any accommodations for specific needs, e.g., disabilities, must follow predefined, documented procedures that are applied consistently and fairly to all eligible candidates, as outlined in the Alcoitao Higher School of Health's official admissions policy. An incorrect approach would be to provide the student with direct hints or advance information about the exam content. This directly violates the principle of examination integrity, as it grants an unfair advantage and undermines the validity of the assessment process. Ethically, this is a breach of trust and fairness towards all other applicants who are preparing under standard conditions. Another incorrect approach would be to dismiss the student's concerns entirely without offering any appropriate guidance or information about existing support mechanisms. While this avoids direct compromise of the exam, it fails to meet the institutional responsibility of student welfare and can lead to unnecessary distress for the applicant, potentially impacting their ability to perform to their full potential due to lack of awareness of legitimate support. The professional decision-making process for similar situations should involve first identifying the core ethical and regulatory principles at play: fairness, integrity, and student welfare. Then, one must assess the specific request against these principles and the established institutional policies. If the request directly compromises these principles or violates policy, it must be declined. However, the professional should then consider how to address the underlying need or concern in a manner that is compliant and ethical, such as directing the student to general information, official support channels, or pre-approved accommodation procedures. Transparency and consistency in applying these principles are paramount. Question 11. System analysis indicates a situation where a cluster of students at Alcoitao Higher School of Health has presented with symptoms consistent with a highly contagious infectious disease. While the immediate concern is public health, the students' health records contain sensitive personal information. Which of the following stakeholder-informed approaches best balances the imperative to protect public health with the ethical and regulatory obligations to maintain patient confidentiality? Option A. Delay any reporting to the Public Health Department until a definitive diagnosis is confirmed and all students have explicitly consented to the disclosure of their health information. Option B. Immediately report the suspected outbreak to the local Public Health Department, providing all available patient details to expedite their investigation. Option C. Inform the student body broadly about the potential health risk through general announcements, without disclosing any specific student information or contacting the Public Health Department directly. Option D. Attempt to obtain informed consent from each affected student to share their specific health information with the Public Health Department, and if consent is not immediately forthcoming, report the situation using anonymized data as per Alcoitao's established protocol. Correct answer is B. Immediately report the suspected outbreak to the local Public Health Department, providing all available patient details to expedite their investigation. Explanation. This scenario presents a professional challenge due to the inherent conflict between the immediate need to address a potential public health risk and the procedural requirements for data handling and patient confidentiality, as mandated by Alcoitao Higher School of Health's internal policies and relevant health data protection regulations. The pressure to act quickly must be balanced against the legal and ethical obligations to safeguard sensitive patient information. Careful judgment is required to ensure that any action taken is both effective in mitigating risk and compliant with established protocols. The correct approach involves a structured communication process that prioritizes patient privacy while ensuring necessary information reaches the appropriate authorities. This approach involves obtaining informed consent from the affected individuals for the disclosure of their health information to the Public Health Department, or, if consent cannot be obtained, and the situation meets the criteria for mandatory reporting under Alcoitao's health regulations, following the established protocol for anonymized or de-identified data disclosure. This aligns with the ethical principle of beneficence, acting in the best interest of public health, and non-maleficence, avoiding harm to individuals through privacy breaches, as well as adhering to the Alcoitao Higher School of Health's commitment to patient confidentiality and data security. An incorrect approach that bypasses consent or established reporting channels to directly inform the Public Health Department without proper authorization would constitute a breach of patient confidentiality and a violation of Alcoitao's internal data protection policies. This failure to follow procedure could lead to disciplinary action and erode patient trust. Another incorrect approach, which is to delay reporting until all possible avenues for consent are exhausted, even when a clear public health risk is identified, and the regulations permit or require immediate reporting of anonymized data, would be a failure of professional duty to protect the wider community, potentially exacerbating the public health issue. A third incorrect approach, which is to ignore the potential public health risk altogether due to concerns about data privacy, would be a dereliction of professional responsibility and a failure to uphold the school's mission of contributing to public health. Professionals should employ a decision-making framework that begins with identifying the potential public health risk and the relevant regulatory requirements for reporting. This should be followed by an assessment of the feasibility of obtaining informed consent from affected individuals. If consent is not obtainable or appropriate, the professional must then consult Alcoitao's specific protocols for anonymized or de-identified data disclosure to public health authorities. Throughout this process, maintaining clear documentation of all steps taken and decisions made is crucial. Question 12. Investigation of a prospective student's response to a hypothetical scenario during the Alcoitao Higher School of Health entrance exam, where they are asked to outline their approach to a mandatory clinical rotation involving patient care practices that may conflict with their deeply held personal beliefs. Which of the following responses best demonstrates an understanding of the professional and ethical requirements for admission to the Alcoitao Higher School of Health? Option A. Acknowledging the potential conflict and stating a commitment to upholding all Alcoitao Higher School of Health clinical protocols and ethical guidelines, while also expressing a willingness to discuss any personal concerns with a designated faculty advisor to find appropriate professional resolutions that do not compromise patient care or academic integrity. Option B. Suggesting that during the clinical rotation, they would discreetly avoid any patient care activities that conflict with their personal beliefs, without informing supervisors, to fulfill the rotation requirements without compromising their convictions. Option C. Stating that personal beliefs would take precedence and that they would be unable to participate in any aspect of the clinical rotation that conflicts with these beliefs, potentially seeking alternative assignments that align with their personal values. Option D. Expressing a strong conviction that the Alcoitao Higher School of Health should accommodate individual personal beliefs by modifying mandatory clinical rotation requirements to suit each student's moral compass. The correct answer is A. Acknowledging the potential conflict and stating a commitment to upholding all Alcoitao Higher School of Health clinical protocols and ethical guidelines, while also expressing a willingness to discuss any personal concerns with a designated faculty advisor to find appropriate professional resolutions that do not compromise patient care or academic integrity. Explanation. This scenario presents a professional challenge due to the inherent conflict between a student's personal beliefs and the ethical obligations of a healthcare professional, particularly within the context of a regulated educational institution like Alcoitao Higher School of Health. The entrance exam aims to assess not only academic aptitude, but also a candidate's understanding of professional conduct and ethical responsibilities within the healthcare sector. A critical aspect of this is the ability to uphold professional standards even when they may clash with personal convictions, ensuring patient well-being and adherence to established healthcare protocols. The correct approach involves acknowledging and respecting the established protocols and ethical guidelines of the Alcoitao Higher School of Health and the broader healthcare profession, even if they conflict with personal beliefs. This demonstrates an understanding of the paramount importance of patient care, professional integrity, and the regulatory framework governing healthcare education and practice. Specifically, adherence to the Alcoitao Higher School of Health's stated policies on professional conduct and the ethical principles underpinning healthcare education is paramount. This approach prioritizes the objective standards required for safe and effective healthcare delivery over subjective personal opinions, aligning with the school's mandate to train competent and ethically sound professionals. An incorrect approach that prioritizes personal beliefs over established protocols would fail to recognize the professional duty of care and the regulatory requirements of the Alcoitao Higher School of Health. This could lead to a failure to provide equitable care or to adhere to essential medical procedures, thereby jeopardizing patient safety and violating ethical codes. Another incorrect approach, which might involve attempting to subtly influence or disregard established protocols based on personal convictions, demonstrates a lack of professional maturity and an inability to operate within a structured, regulated environment. This undermines the integrity of the educational process and the future practice of healthcare. A further incorrect approach, such as expressing a refusal to engage with certain aspects of healthcare education due to personal beliefs without seeking appropriate guidance or understanding the implications, shows a disregard for the comprehensive nature of healthcare training and the responsibilities of a future healthcare provider. The professional decision-making process for similar situations should involve a thorough understanding of the Alcoitao Higher School of Health's regulatory framework, ethical guidelines, and the specific requirements of the healthcare profession. Candidates must be able to critically evaluate their personal beliefs against these professional standards and demonstrate a commitment to upholding the latter. This involves a willingness to engage with diverse perspectives, to understand the rationale behind established protocols, and to prioritize the well-being and rights of patients above all else. When personal beliefs present a potential conflict, the professional approach is to seek clarification, understand the ethical and regulatory implications, and to commit to acting in accordance with professional obligations. Question 13. The efficiency study reveals that a member of the Alcoitao Higher School of Health's admissions committee has a close personal relationship with one of the applicants being reviewed. This committee member is responsible for evaluating the applicant's academic qualifications and potential contribution to the health field. What is the most ethically sound and procedurally correct course of action for this committee member to take? According to the Alcoitao Higher School of Health's internal guidelines on professional conduct and conflict of interest. Option A. Proceed with the evaluation, but make a conscious effort to remain objective and unbiased in their assessment of the applicant. Option B. Immediately disclose the personal relationship to the admissions committee chair and the designated ethics officer, and recuse themselves from any discussion or decision-making regarding that specific applicant. Option C. Discreetly exclude the applicant's file from their review workload, hoping it goes unnoticed. Option D. Inform the applicant privately about the potential conflict and ask them if they are comfortable with the committee member evaluating their application. Correct answer is B. Immediately disclose the personal relationship to the admissions committee chair and the designated ethics officer, and recuse themselves from any discussion or decision-making regarding that specific applicant. Explanation. The efficiency study reveals a potential conflict of interest within the Alcoitao Higher School of Health's admissions committee. This scenario is professionally challenging because it requires balancing the integrity of the admissions process with the personal and professional relationships of committee members. Upholding fairness and transparency is paramount to maintaining public trust in the institution and its graduates. The correct approach involves immediate disclosure of the potential conflict to the relevant oversight body or designated ethics officer within Alcoitao Higher School of Health. This aligns with the Alcoitao Higher School of Health's internal guidelines on ethical conduct and conflict of interest, which mandate transparency and recusal from decisions where a personal relationship could influence judgment. By disclosing, the committee member allows for an objective assessment of the situation and ensures that any subsequent decision is made without bias, thereby safeguarding the fairness of the admissions process. An incorrect approach would be to proceed with the evaluation without disclosing the relationship. This failure to disclose violates the Alcoitao Higher School of Health's ethical framework, which emphasizes integrity and impartiality. It creates an appearance of impropriety, even if no actual bias occurred, and erodes trust in the admissions committee's decisions. Another incorrect approach is to attempt to manage the conflict internally by simply promising to be objective. While well-intentioned, this does not provide the necessary external oversight or assurance of impartiality required by ethical standards. The Alcoitao Higher School of Health's guidelines likely require formal recusal or a review by an independent party when a conflict is identified, not just a personal assurance. Finally, withdrawing from the committee entirely without proper notification or handover could also be problematic. While recusal is often the correct action, an abrupt departure without ensuring continuity or proper delegation of duties could disrupt the admissions process and potentially disadvantage other candidates or the institution. The Alcoitao Higher School of Health's policies would typically outline a process for managing such situations to minimize disruption. The professional decision-making process in such situations should involve 1. Identifying the potential conflict of interest. 2. Consulting the Alcoitao Higher School of Health's internal policies and ethical guidelines. 3. Disclosing the conflict to the appropriate authority. 4. Following the prescribed procedure for recusal or mitigation, which may involve abstaining from voting or discussion, or having the decision reviewed by an independent party. 5. Ensuring that the process remains fair and transparent for all stakeholders. Question 14. System analysis indicates that an applicant to the Alcoitao Higher School of Health entrance exam is tasked with a scenario-based question requiring them to illustrate their understanding of a specific medical condition. The applicant has access to anonymized case studies from a previous academic year's coursework, but also has a personal acquaintance who is currently undergoing treatment for a similar condition. Considering the Alcoitao Higher School of Health's emphasis on ethical conduct and data privacy, which of the following approaches best demonstrates the applicant's readiness for a health profession? Option A. Attempt to contact the acquaintance to gather more detailed, albeit potentially identifiable, information about their current treatment to enrich the response. Option B. Utilize the anonymized case studies provided as part of the official examination materials to construct the response, ensuring no personal identifying information is revealed. Option C. Discuss the general characteristics of the condition using publicly available medical literature, omitting any reference to specific cases or personal acquaintances. Option D. Create a hypothetical patient profile based on general knowledge of the condition, without referencing any specific individuals or case studies. The correct answer is B. Utilize the anonymized case studies provided as part of the official examination materials to construct the response, ensuring no personal identifying information is revealed. Explanation. This scenario presents a professional challenge for a prospective student at Alcoitao Higher School of Health due to the inherent responsibility associated with healthcare professions. The challenge lies in discerning the ethical and regulatory implications of information access and disclosure, particularly when it involves sensitive patient data. Careful judgment is required to balance the need for academic learning with the paramount duty of patient confidentiality and data privacy, as mandated by the Alcoitao Higher School of Health's entrance examination framework. Correct approach involves prioritizing the protection of patient confidentiality and adhering strictly to the Alcoitao Higher School of Health's established guidelines on data handling and ethical conduct during the entrance examination process. This approach is right because it directly aligns with the core principles of healthcare ethics and the specific regulatory framework governing health education admissions. The Alcoitao Higher School of Health, in its entrance examination, expects candidates to demonstrate an understanding of and commitment to patient privacy, which is a fundamental ethical and legal obligation in any health-related field. Accessing or using patient information without explicit consent or for purposes beyond the scope of the examination would constitute a serious breach of these principles. An incorrect approach that involves attempting to access or utilize any patient information, even for the purpose of demonstrating understanding of a health-related concept, is professionally unacceptable. This failure stems from a disregard for patient confidentiality, a cornerstone of healthcare ethics and a likely component of the Alcoitao Higher School of Health's admission criteria. Such an action would violate the trust placed in healthcare professionals and could have legal ramifications, even at the applicant stage. Another incorrect approach, which might involve discussing hypothetical patient scenarios without proper anonymization or consent, also fails to uphold the required standards of privacy and ethical conduct. While seemingly less direct, it still risks breaching confidentiality principles and demonstrates a lack of understanding of sensitive data management. The professional decision-making process for similar situations should involve a clear understanding of the governing ethical codes and institutional policies. When faced with a task that could potentially involve sensitive information, a professional should first identify the nature of the information and the relevant regulations. If there is any doubt about the permissibility of accessing or using information, the default position should always be to err on the side of caution and non-disclosure, seeking clarification from appropriate authorities if necessary. In the context of an entrance exam, this means relying solely on publicly available information or hypothetical scenarios that do not compromise real patient data. Question 15. When evaluating the suitability of candidates for admission to health programs at Alcoitao Higher School of Health, What is the most appropriate approach to gathering information regarding their health status, considering the need to assess their capacity for practical training while upholding privacy and ethical standards? Option A. Ask applicants to self-report any health conditions they deem significant without providing specific guidance on what constitutes relevance to health program training. Option B. Request a comprehensive medical history from all applicants, including past diagnoses and treatments, to ensure a complete understanding of their overall health before admission. Option C. Rely on informal inquiries and background checks to gather anecdotal information about applicants' health that might affect their performance in practical settings. Option D. Conduct a thorough impact assessment to identify specific health-related criteria directly relevant to program requirements and practical training, requesting only the minimum necessary information with explicit consent and clear purpose limitation. The correct answer is D. Conduct a thorough impact assessment to identify specific health-related criteria directly relevant to program requirements and practical training, requesting only the minimum necessary information with explicit consent and clear purpose limitation. Explanation. This scenario presents a professional challenge because it requires balancing the immediate need for information with the ethical and regulatory obligations to protect patient privacy and data integrity. The Alcoitao Higher School of Health entrance exam, like many health-related institutions, operates under strict guidelines regarding the handling of sensitive personal and health information. The core of the challenge lies in determining the appropriate level of detail to request and how to ensure that any information obtained is used solely for the stated purpose of assessing applicant suitability for health programs, without infringing on privacy rights or exceeding the scope of legitimate inquiry. The correct approach involves a structured and transparent impact assessment process that prioritizes data minimization and purpose limitation. This means identifying only the essential information needed to evaluate an applicant's fitness for health studies, such as academic prerequisites and any relevant health declarations that directly impact their ability to undertake practical training or pose a risk to themselves or others in a clinical setting. This approach is justified by the principles of data protection and ethical research, which are implicitly embedded in the regulatory framework governing educational institutions and health data. Specifically, it aligns with the need for proportionality, collecting only what is necessary, and transparency, ensuring applicants understand what information is being sought and why. An incorrect approach would be to request a comprehensive medical history without a clear, demonstrable link to the applicant's suitability for the program. This fails to adhere to the principle of data minimization, as it collects more information than is strictly necessary for the stated purpose. Such an approach could also violate the principle of purpose limitation, as the broad collection of health data might inadvertently lead to its use for purposes beyond the entrance exam assessment, such as profiling or discriminatory practices. Furthermore, requesting overly sensitive personal health information without a robust justification and clear consent mechanisms would likely contravene ethical guidelines and potentially violate data protection regulations, leading to a breach of trust and legal repercussions. Another incorrect approach would be to rely on informal or unverified sources of information about an applicant's health, as this bypasses established protocols for data collection and verification, compromising both accuracy and privacy. A professional decision-making process for similar situations should involve a systematic risk assessment. This begins with clearly defining the objective of the information collection. Next, identify all potential data points that could contribute to achieving that objective. Then, critically evaluate each data point for its necessity and proportionality, considering less intrusive alternatives. Establish clear protocols for data handling, storage, and access, ensuring compliance with all relevant regulations. Finally, ensure transparency with the individuals whose data is being collected, providing them with clear information about the purpose, scope, and safeguards in place. Question 16. Strategic planning requires a thorough evaluation of potential future directions. Considering the Alcoitao Higher School of Health's commitment to excellence and ethical practice, which of the following approaches best ensures that proposed strategic initiatives are both beneficial and sustainable? Option A. Conducting a comprehensive impact assessment that analyzes financial, academic, operational, and ethical implications of each initiative, alongside stakeholder consultation. Option B. focusing exclusively on technological advancements that promise efficiency gains, without considering their integration challenges or impact on teaching methodologies. Option C, prioritizing initiatives that offer the quickest return on investment, regardless of their long-term effect on educational quality. Option D, implementing popular initiatives that garner immediate positive attention, without detailed analysis of their feasibility or resource requirements. The correct answer is A, conducting a comprehensive impact assessment that analyzes financial, academic, operational, and ethical implications of each initiative, alongside stakeholder consultation. Explanation. This scenario presents a professional challenge because the Alcoitao Higher School of Health, as an educational institution, has a responsibility to ensure its strategic planning processes are robust, ethical, and compliant with relevant educational regulations and best practices. The challenge lies in balancing the need for forward-thinking vision with the practicalities of resource allocation, stakeholder engagement, and adherence to established academic and administrative standards. Careful judgment is required to avoid short-sighted decisions that could compromise the quality of education or the institution's long-term viability. The correct approach involves a comprehensive impact assessment that systematically evaluates the potential consequences of proposed strategic initiatives across various dimensions. This includes financial viability, academic quality, student experience, faculty development, community engagement, and regulatory compliance. Such an assessment allows for informed decision-making by identifying potential risks and opportunities, enabling mitigation strategies, and ensuring that the strategic plan aligns with the institution's mission and values. This aligns with the principles of good governance and responsible management expected of higher education institutions, ensuring that decisions are evidence-based and serve the best interests of all stakeholders, as implicitly guided by the overarching framework for educational institutions. An incorrect approach that focuses solely on immediate cost savings, without considering the long-term impact on educational quality, would be professionally unacceptable. This failure stems from a lack of foresight and a disregard for the core purpose of the institution, potentially leading to a decline in academic standards and reputational damage. Another incorrect approach that prioritizes popular but unsustainable initiatives without rigorous feasibility studies would also be flawed. This demonstrates a lack of due diligence and a failure to adhere to sound financial and operational management principles, risking the institution's stability. Finally, an approach that neglects to consult key stakeholders, such as faculty, students, and the wider community, would be ethically problematic. This oversight undermines transparency and collaborative decision-making, potentially leading to resistance and a lack of buy-in for the strategic plan. The professional decision-making process for similar situations should involve a structured approach. First, clearly define the strategic objectives. Second, identify all potential initiatives to achieve these objectives. Third, for each initiative, conduct a thorough impact assessment covering financial, academic, operational, ethical, and regulatory dimensions. Fourth, engage relevant stakeholders throughout the process to gather input and build consensus. Fifth, analyze the findings of the impact assessment to prioritize initiatives, develop mitigation plans for risks, and select the most viable and beneficial strategies. Finally, document the rationale for decisions and establish mechanisms for ongoing monitoring and evaluation. Question 17. Analysis of how a prospective student at Alcoitao Higher School of Health should ethically present information about a voluntary research study to fellow prospective students, considering the school's commitment to ethical research practices and the protection of participant rights. Option A. Share personal anecdotes about positive experiences in similar research to build enthusiasm and encourage involvement. Option B. Highlight the importance of the research for the student's own academic profile and encourage participation to support their future career. Option C. Emphasize the potential benefits of the research and encourage participation to contribute to scientific advancement. Option D. Provide a brief overview of the study and direct interested individuals to the official study information and consent forms for full details. The correct answer is C. Emphasize the potential benefits of the research and encourage participation to contribute to scientific advancement. Explanation. The scenario presents a challenge for a prospective student at Alcoitao Higher School of Health regarding the ethical implications of research participation. The core of the challenge lies in balancing the desire to contribute to scientific advancement with the fundamental right of individuals to informed consent and the protection of vulnerable populations, as stipulated by Alcoitao's internal ethical guidelines and general principles of health research ethics. The student must navigate the potential for coercion and ensure that participation is entirely voluntary and based on a clear understanding of the research. The correct approach involves a thorough understanding and application of the principles of informed consent as outlined in Alcoitao's research ethics framework. This framework emphasizes that potential participants must be provided with comprehensive information about the study's purpose, procedures, risks, benefits, and their right to withdraw at any time without penalty. The student's responsibility is to ensure that any information they share about research opportunities is presented in a neutral, objective manner, devoid of any pressure or undue influence, and that they actively facilitate access to the official study information and consent forms. This aligns with Alcoitao's commitment to ethical research conduct and the protection of participant autonomy. An incorrect approach would be to present the research opportunity in a way that subtly encourages participation, perhaps by highlighting only the potential benefits or downplaying the risks. This violates the principle of voluntariness and can be considered coercive, especially if the student holds any perceived authority or influence over their peers. Another incorrect approach would be to provide incomplete or misleading information about the study, thereby undermining the informed consent process. This directly contravenes Alcoitao's ethical guidelines, which mandate full transparency. Finally, failing to direct potential participants to the official study documentation and consent process, or attempting to bypass it, represents a significant ethical breach and a disregard for established research protocols. The professional decision-making process in such situations requires a commitment to ethical principles, a clear understanding of relevant regulations and institutional policies, and the ability to prioritize the well-being and rights of individuals over the expediency of recruitment. Professionals should always err on the side of caution, ensuring that all actions are transparent, voluntary, and fully compliant with ethical standards. Question 18. Compliance review shows that the Alcoitao Higher School of Health is planning a new community health outreach program. To evaluate its potential impact, a research team proposes an impact assessment. Which of the following approaches best balances the need for comprehensive evaluation with the ethical and regulatory obligations of the institution? Option A. Prioritize collecting the widest possible range of quantitative data from all program touchpoints, assuming that the public nature of some health information negates the need for explicit consent. Option B. Conduct a rapid assessment by observing program activities and gathering feedback from staff, without formally documenting individual participant data or seeking consent, to expedite the evaluation process. Option C. Design the assessment to collect detailed demographic and health status data from all potential beneficiaries, ensuring data is anonymized only after analysis, and obtaining informed consent for participation and data use. Option D. Focus the assessment on readily available aggregated statistics from public health databases, supplemented by informal interviews with community leaders, without directly engaging program beneficiaries for consent. The correct answer is C. Design the assessment to collect detailed demographic and health status data from all potential beneficiaries, ensuring data is anonymized only after analysis, and obtaining informed consent for participation and data use. Explanation. This scenario presents a professional challenge due to the inherent conflict between the need to assess the impact of a new health program and the ethical obligation to protect the privacy and confidentiality of potential participants. The Alcoitao Higher School of Health, as an educational institution involved in health-related research and practice, must adhere to strict ethical guidelines and data protection regulations. Careful judgment is required to balance the pursuit of knowledge and program improvement with the fundamental rights of individuals. The correct approach involves a comprehensive impact assessment that prioritizes ethical considerations and regulatory compliance from the outset. This means designing the assessment methodology to minimize data collection, anonymize data wherever possible, and obtain informed consent from all participants. It requires a thorough understanding of Alcoitao's internal policies on research ethics, data privacy, and any relevant national health data protection laws. The justification for this approach lies in upholding the principles of beneficence, ensuring the program benefits society without undue harm to individuals. Non-maleficence, avoiding harm, and respect for autonomy, ensuring individuals have control over their data and participation. Adhering to these principles and relevant regulations safeguards the reputation of the institution and builds trust with the community. An incorrect approach that focuses solely on maximizing data collection for a more statistically robust assessment, without adequate consideration for privacy, would be ethically and regulatorily unsound. This failure would violate principles of data minimization and purpose limitation, potentially leading to breaches of confidentiality and trust. Another incorrect approach that bypasses the need for informed consent, perhaps by assuming implied consent or by collecting data from publicly available but sensitive sources without explicit permission, would directly contravene fundamental ethical principles and data protection laws, exposing the institution to legal repercussions and reputational damage. A third incorrect approach that relies on anecdotal evidence or superficial observations without a structured, ethical assessment framework would fail to provide reliable impact data and could lead to misguided program decisions, while also potentially overlooking ethical considerations in data gathering. The professional decision-making process for similar situations should involve a multi-stakeholder consultation, including ethics review boards, legal counsel, and potential participant representatives. A risk-benefit analysis should be conducted for each stage of the impact assessment, with a clear emphasis on mitigating risks to participants' privacy and well-being. Transparency in methodology and data handling is paramount, and continuous ethical review throughout the assessment process is essential to adapt to unforeseen challenges and ensure ongoing compliance. Question 19. The risk matrix shows a potential cluster of a novel respiratory illness among students attending a recent campus event. Given the limited initial information and the potential for rapid spread, which of the following actions best reflects the Alcoitao Higher School of Health's approach to managing such a public health concern? Option A. Disseminate preliminary symptom information to local media outlets to raise public awareness and encourage vigilance. Option B. Immediately alert all students and faculty via mass email about the potential outbreak, including details about the symptoms observed, while initiating a broad internal investigation. Option C. Focus on isolating all students who attended the event in their dormitories as a precautionary measure, pending further investigation. Option D. Proceed with laboratory confirmation of the illness, and upon confirmation, report the findings through the designated public health channels before any broader communication. The correct answer is B. Immediately alert all students and faculty via mass email about the potential outbreak, including details about the symptoms observed, while initiating a broad internal investigation. Explanation. The scenario presents a common challenge in healthcare settings, balancing the need for rapid response to a potential public health threat with the ethical and regulatory obligations to protect patient privacy and ensure accurate information dissemination. The professional challenge lies in navigating the immediate urgency of a potential outbreak against the established protocols for data handling and communication, which are designed to prevent misinformation and protect individual rights. Careful judgment is required to determine the appropriate level of detail and the correct channels for communication without causing undue alarm or violating confidentiality. The correct approach involves a structured, evidence-based impact assessment that prioritizes verification and adherence to established public health reporting guidelines. This approach is right because it aligns with the Alcoitao Higher School of Health's commitment to evidence-based practice and ethical conduct. Specifically, it adheres to the principles of public health surveillance and reporting, which mandate that initial reports of potential outbreaks be treated with caution, verified through laboratory confirmation, and communicated through designated public health authorities. This ensures that information is accurate, minimizes the risk of false alarms, and allows for a coordinated and effective response. It respects patient confidentiality by not prematurely disclosing identifying information. An incorrect approach that immediately escalates the situation without verification fails to uphold the principle of accuracy and can lead to panic and reputational damage. It bypasses established communication channels, potentially violating protocols for reporting infectious diseases and undermining the authority of public health bodies. Another incorrect approach that focuses solely on immediate containment without considering the broader public health implications or the need for accurate reporting, overlooks the systemic requirements for managing infectious disease threats. This could lead to inefficient resource allocation and a delayed or ineffective response. Finally, an approach that prioritizes public disclosure over verification and established protocols risks spreading misinformation, violating patient privacy, and creating public distrust, all of which are ethically and regulatorily unacceptable. Professional decision-making in such situations should involve a systematic process. First, acknowledge the potential risk and initiate preliminary investigation. Second, consult relevant internal protocols and external public health guidelines. Third, gather and verify evidence, including laboratory confirmation if applicable. Fourth, communicate findings through designated channels to appropriate authorities. And finally, implement containment and response measures based on confirmed data and expert guidance. Question 20. Research into the effectiveness of a new diagnostic technique for a common ailment among patients at Alcoitao health clinics has been proposed for inclusion in the final year curriculum of the Alcoitao Higher School of Health's nursing program. The research aims to analyze patient outcomes and identify areas for improved clinical practice. Which of the following approaches best adheres to the Alcoitao Higher School of Health's regulatory framework for student research involving patient data? Option A. Proceeding with the analysis of patient data without seeking any form of consent, assuming that the educational benefit to students outweighs the need for patient authorization. Option B. Using patient data that has been partially anonymized, where some demographic information remains, to provide richer context for the case studies. Option C. Utilizing anonymized patient data from the clinics, where all direct and indirect identifiers have been removed to a degree that re-identification is impossible, and obtaining general consent from patients for the use of their anonymized data in educational research. Option D. Accessing and analyzing patient records directly from the clinics, including names and specific dates of treatment, for the purpose of creating case studies for student learning. The correct answer is C. Utilizing anonymized patient data from the clinics, where all direct and indirect identifiers have been removed to a degree that re-identification is impossible, and obtaining general consent from patients for the use of their anonymized data in educational research. Explanation. The scenario presents a common challenge in healthcare education, balancing the need for comprehensive student assessment with the ethical imperative to protect patient privacy and data integrity. The Alcoitao Higher School of Health, operating under its specific regulatory framework, must ensure that any research involving patient data adheres strictly to established guidelines for data anonymization and consent. The professional challenge lies in designing research that yields meaningful educational insights without compromising the trust placed in the institution by patients or violating their rights. Careful judgment is required to select an approach that is both academically rigorous and ethically sound, reflecting the school's commitment to responsible practice. The correct approach involves a robust anonymization process that renders patient data unidentifiable, coupled with obtaining informed consent for the use of anonymized data in educational research. This aligns with the Alcoitao Higher School of Health's regulatory framework, which prioritizes patient confidentiality and data protection. By ensuring that no individual can be identified from the data, the school upholds its ethical obligations and regulatory compliance, allowing for valuable learning experiences without risk to patients. An incorrect approach would be to use patient data without adequate anonymization, even if the intention is solely for educational purposes. This directly violates the Alcoitao Higher School of Health's regulatory framework concerning patient privacy and data security. Another incorrect approach would be to proceed with data analysis without attempting to obtain informed consent, even if the data is anonymized. While anonymization is crucial, the regulatory framework often mandates a process for informing patients about the potential use of their data for research and education, even in anonymized form, to maintain transparency and respect. A third incorrect approach would be to rely on assumptions about patient consent without a formal process, as this introduces a significant risk of noncompliance and ethical breach. The professional decision-making process for similar situations should involve a thorough review of the Alcoitao Higher School of Health-specific regulations regarding patient data and research. This includes understanding the requirements for data anonymization, consent procedures, and ethical review. Professionals should consult with the school's ethics committee or relevant oversight body to ensure their research design meets all compliance standards before commencing any data collection or analysis. Prioritizing patient rights and data integrity is paramount.